Interior Department to monitor compliance of local government units with directive to pass anti-discrimination ordinance. Valenzuela City to begin localized mass testing for COVID-19 tomorrow. The Philippines ranks 6th among 23 Western Pacific region countries with coronavirus cases. Hungary prolongs its nationwide lockdown indefinitely, while Lebanon extends almost month-long shutdown by another 2 weeks. Boston-based company produces 3D printed swabs.
Local government units must be sure to pass and enforce an ordinance prohibiting the discrimination against healthcare workers and other frontliners fighting COVID-19. Rosalie Cos details why.
The Interagency Task Force for the Management of Emerging Infectious Diseases has directed local governments to pass anti-discrimination executive orders or ordinances for COVID-19 frontliners. This following reports of discrimination against health workers and other frontliners in some parts of the country. Interior Secretary Eduardo Año said his department will monitor the LGU's compliance with this directive coming from the IATF. A few cities have passed such ordinance. Acts of discrimination against frontliners include refusal of basic services like public transport and laundry service, refuse entry to supermarkets, eviction from lodging or housing, and even physical injuries. The DILG also wants overseas Filipino workers who are returning to their provinces, as well as COVID-19 confirmed and suspected patients, to be covered by the anti-discrimination ordinance. Secretary Año emphasizes the importance not only of the passage but also the proper enforcement of the ordinance. Penalties must be imposed on violators, he adds. It is President Rodrigo Duterte himself who ordered the police to intensify their protection and assistance for healthcare workers. Rosalie Cos, UNTV, News and Rescue. We serve the people, we give glory to God.
Almost every city, every town is battling COVID-19. In Valenzuela City, Metro Manila, the local government has stepped up its execution of plans to beat the virus. Dante Amento reports.
Valenzuela City has approved Ordinance 687 or the Wear Your Face Mask Ordinance. It states the mandatory wearing of face mask outdoors or in public places.
Lahat po ng mamimili at papasok sa loob ng palengke, kailangan po may mask.
Ay, meron akong mask. Hindi ko na nagamit.
Violators will be fined between 1,000 pesos and 5,000 pesos. Valenzuela City will also begin its localized mass testing for COVID-19 tomorrow. The targeted population are patients under investigation or PUI, persons under monitoring or PUM, healthcare workers, and overseas Filipino workers. Testing is free of charge. Swab samples will be brought to a partner hospital for the test. For queries, especially those who may have symptoms, just call the Valenzuela City COVID-19 hotline at 8353-5000. Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
The Philippines awaits financial help from the World Bank through billions of pesos worth of loan. Asher Kadapan Jr. will tell us why.
The executive directors of the World Bank have approved the Philippines loan amounting to $500 million or equivalent to about 25 billion pesos. It aims to strengthen the Philippine government's capacity to address disaster concerns and to support the urgent needs brought about by the COVID-19 crisis. The World Bank has expressed its solidarity with the people of the Philippines by providing financial support to help the country as it faces the impact of the COVID-19 pandemic. According to Akim Falk, the acting country director of World Bank for Philippines, Brunei, Malaysia, and Thailand, they are committed to help the country in its response to COVID-19 as well as its effect to the economy. The Philippine government is also looking to tap Asian Development Bank and commercial market to borrow about $5.6 billion to aid the country's need amid the pandemic.
So we are also coming up with the program to continuously borrow more money to support the Philippine economy and our fight against this COVID.
Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, the Philippines may be far from being top among countries with the most number of coronavirus cases in the world, but it is in the top 10 countries in the Western Pacific region. Aiko Miguel explains why.
The Philippines remains sixth among the 23 countries in the Western Pacific region hit by the COVID-19 pandemic. Yesterday, April 9, coronavirus cases in the country reached the 4,000-plus breach, with a total of 4,076. 124 recovered and 203 died from the coronavirus disease. According to the World Health Organization Western Pacific region, the Philippines has the second highest fatality rate in the region, which is now at 4.98%. WHO reminds countries that implemented enhanced community quarantine like the Philippines to continue conducting contact tracing.
Government has to ensure the basic lifelines will maintain. So if you don't have those kind of structures, it's very difficult to make those measures. And lockdown, to be effective, we have to also continue find the case, isolate, and treat early, and also trace and quarantine those contacts.
The Philippines Health Department has repeatedly stated that the increasing number of COVID-19 cases in the country is due to our expanded testing capacity. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Once the largest outbreak outside China, South Korea reports today new coronavirus cases only in the 20s. In France, the health agency says they now hope for a plateau. Kat Maraos explains why.
The number of people in intensive care units for coronavirus infection in France fell slightly for the first time since the start of the epidemic, the French health agency director said on April 9.
Des besoins de réanimation.
This needs to find new beds, new medical teams, new machines. It is reduced for the first time and we can then hope for a plateau. But it's a plateau that is very high and we must remain extremely cautious.
Et il faut rester extrêmement prudent.
The official explained the difference between the newly admitted patients and the one who have left intensive care, which represents the total number of additional patients to take in each day, is for the first time slightly negative, 82 patients. However, the number of people dying in nursing homes jumped by more than 50% over 2 days, Health Ministry data showed on Thursday. In South Korea, Daegu City, which has reported more than half South Korea's 10,450 confirmed cases, today reported 0 new patients for the first time since case patient number 31 was confirmed. South Korean Vice Health Minister Kim Kang-lip said that from yesterday's 39 newly confirmed coronavirus, there are only 27 new patients today, the first decrease to the 20s in around 50 days.
This is the result of social distancing, which we made during the past 3 weeks.
22 of the 27 newly confirmed cases are from domestic transmission. 5 new cases are from overseas, with 4 detected at quarantine checkpoint and 1 detected in the local community. They are South Korean citizens except 1 patient. Kat Dumaraos, UNTV News and Rescue. We serve the people, we give glory to God.
And now here's the latest count of coronavirus cases around the world. The COVID-19 pandemic has reached 1,611,981 people in 185 countries and regions as of 5 p.m. today. The fast-spreading disease has claimed 96,783 lives, with 361,235 recoveries across the world. The United States of America remains to have the most reported confirmed cases, with 466,209 1,099, while 26,522 patients in America's hospitals have recovered from the disease. Italy, meanwhile, still has the most coronavirus-related deaths globally, with 18,279 fatalities of its 143,626 confirmed positives. Spain has more than one-third of USA's confirmed cases, now at 157,022. France has so far reported 118,785 total confirmed cases, with 23,441 recoveries. Germany has 118,235, while data from Johns Hopkins University CSSC show that 93.77% of China's confirmed cases have already recovered. In the Philippines, the DOH reports 119 new cases, bringing the total confirmed cases in the country to 4,195. 18 more patients have died. The death toll is now at 221. A total of 140 coronavirus patients have recovered as of today, with 60 new recoveries in various parts of the country. The Department of Labor and Employment, or DOLE, is formulating a recovery plan for employers and small and medium businesses after the ECQ period. Vincent Arboleda will tell us why.
Business confidence should be restored among entrepreneurs to ensure that their workers would still have jobs to return to after the enhanced community quarantine and lockdowns. DOLE is coordinating with the Department of Trade and Industry to help entrepreneurs affected by the ECQ to combat the threat of COVID-19 on their businesses.
Our paramount consideration now is for the businesses to have confidence so that they will continue to create economic activity. This economic activity will restore employment opportunities to the workers.
Priority among these will be micro, small, and medium enterprises or MSMEs.
What we need to do is to coordinate with DTI. Sino-sino ba yung mag-aabil ng kanilang packages of assistance? So that kapag naibalik po, nag-resume po sila ng operation, we will just need to advise the workers, balik na sa trabaho, ganito po tuloy-tuloy din po yung economic activity.
DOLE will still implement physical distancing and other safety measures in workplaces to prevent the spread of the virus.
May impact po yun dun sa business, lalong-lalo na po dun sa tourism, especially yung labor-intensive industries. These are things that we will consider in the recovery planning.
The Labor Department aims to complete the recovery plan before the period of the extended ECQ in Luzon ends on April 30. Vincent Arboleda, UNTV News and Rescue. We serve the people. We give glory to God.
Meanwhile, some pawn shops in Metro Manila see a rise in the number of customers amid the ECQ. Meanwhile, payment of pawn loans may be deferred during enhanced community quarantine period. Let's find out why from Asher Cadapan Jr.
Queues of customers at pawn shops in Metro Manila are noticeable since ECQ in Luzon began. Some pawnbrokers say that services, particularly money transfer and pawn loan, have increased since mid-March.
Bali, ngayon po kasi dumoble po yung bilang kasi nga po dala na lang po siguro nung pangangailangan ng tao. Bali, mostly po remittance po kami.
But due to higher number of customers, some pawn shops experience a shortage of funds.
Pag umaga, pag-payout sila maaga pa, sabihin ko, ma'am sir, balik na lang kayo ng tanghali o kayo balik kayo after 1 or 2 hours. Kasi pag iniipon pa namin yung mga nagpapadala ng pera. Pero pag ang mga payout nila sir, mga mabababa lang, yung 3,000 pababa, yung kaya naman ng pondo, binibigyan naman namin.
To help the citizens who use the services of pawn shops amid the present crisis, the Bayanihan to Heal as One law provides a 30-day mandatory grace period to loan pawners who would fail to pay their dues while ECQ is in place. Pawnbrokers are ordered to waive any interest, penalty, or any other fees accounted for such delay. Some pawn shops, however, have initiated such policy since the ECQ started.
Hanggang matapos po yung lockdown, kung sakaling lumagpas man po yung due date nila, hindi na po namin sila sinisingil ng interest. Kung magkano lang po yung principal amount, yun na lang po yung sinisingil namin sa kanila.
Despite the threat of COVID-19, pawnbrokers continue to provide service to help people get by in these trying times. Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
Filipinos are now finding various ways on how to live normally and earn money amid the Luzon-wide enhanced community quarantine. But some buyers turn to the internet to buy raw meat and even fruits. Joanna tells us why.
Online delivery service is one of the most in-demand businesses during the ECQ period as people are ordered to stay at home. But did you know there are online markets for fish, fruits, vegetables, and meat too? Just order using the internet and have the goods you want to buy delivered right at your door. Through this, the movement of people can be limited. Some of these online markets have their own websites. Others created either private groups or accounts on Facebook. To place an order, customers just have to send a private message to the chosen online market. The address, contact details, and mode of payment are also required to complete an order. An online market has set minimum order requirements depending on its management. The Department of Agriculture has even partnered with an online shopping site that sells organic foods as part of the agency's Kadiwa Market. The online site sells vegetables and other products coming from local farmers affected by the ECQ. Delivery is available within Metro Manila and Antipolo Rizal. The Agriculture Department assures the agricultural products available in the online site are sold at reasonable prices. Joanna, UNTV News and Rescue. We serve the people, we give glory to God.
The Philippines continues to receive help from foreign countries amid this fight against COVID-19. Not only medical supplies, but also more than 1,000 cots to be distributed to hospitals and quarantine facilities in the country. Arlene Delgado details why.
The United States donated today 1,300 new cots to the Philippines. The donations were received by Foreign Affairs Secretary Teodoro Locsin Jr. and Office of the Civil Defense Administrator and Undersecretary Ricardo Halad. According to U.S. Ambassador to the Philippines Sung Kim, the cots were originally intended for the Balikatan 2020 joint military exercises. He added that the U.S. is also providing the Philippines almost 204 million pesos in health assistance to help address the COVID-19 crisis. Meanwhile, the Federation of Indian Chambers of Commerce and Industry has donated 150,000 masks worth over 12 million pesos. The donation includes 75,000 pieces of KN95 mask and 75,000 pieces of N88 mask. The face mask has been turned over to OCD and will be distributed to hospitals across the country. Arlene Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
Pangasinan cheers for the first COVID-19 recovery in the province. Meanwhile, students and teachers in Agusan del Norte got busy with artwork dedicated to frontliners. Sherwin Kulubong tells us why.
A 54-year-old nurse who had turned into a COVID-19 patient has been sent off from the hospital where she recovered from the deadly respiratory disease. She got admitted on March 16, but after receiving test results from Baguio General Hospital which showed negative, she has been allowed to return home. Doctors and nurses in Pangasinan Provincial Hospital cheered for the province's first successful recovery. The female nurse got infected through local transmission after exposure to a doctor who tested positive for coronavirus, according to authorities. She must undergo a 14-day quarantine and another test will follow. Meanwhile, teachers and students in various schools in Agusan del Norte province sent various messages of gratitude to COVID-19 frontliners. These include posters, videos, creative photos, and other creative work.
We really hope that they'd be inspired and they really be reminded na ilang efforts will not go waste.
These artworks will be sent to frontliners across the province. The initiative is based on a division memorandum on COVID-19 frontliners, says DepEd Agusan del Norte.
Pero even if we are at home, we can still do something like inspire our frontliners. Kay
These are just one of the many ways to give messages of hope and thanks amid a global tragedy. Sherwin Kulubong, UNTV News and Rescue. We serve the people. We give glory to God.
As the enhanced community quarantine rages on, the clamor to include the middle-income households in the government's emergency subsidy grows. But who can really be considered as the middle class? Let's find out as Harleen Delgado reports.
In one of his addresses to the nation, President Rodrigo Duterte acknowledged the appeal of Cavite Governor John Vic Remulla to consider the plight of the middle class amid the battle against coronavirus disease. The Interagency Task Force for the Management of Emerging Infectious Diseases says the government is still studying the proposed cashed aid to middle-income households. But who really are classified as middle-class families? In one of the policy notes published by the Philippine Institute for Development Studies in 2018, it shows that families belonging to the middle-income class are those that have incomes between 2 and 12 times the poverty line. In its calculations based on the Family Income and Expenditure Surveys of the Philippine Statistics Authority, it identified 3 income classes, including the middle clusters, the lower middle-income class, the middle-income class, and the upper middle-income class. In 2017, a family of 5 can be considered middle income if it has a monthly income of roughly 20,000 pesos to 115,000 pesos. While in the 2015 population, 2 in every 5 Filipinos belong to middle-income class, which makes up 40% or less than half of the country's households. Most of the middle-class families predominantly reside in urban areas, with more than half lived in National Capital Region, Central Luzon, and Calabarzon. Meanwhile, 73% of middle-income households resided in their own houses, 23% resided in rented houses, while 3% were informal settlers. In terms of employment, the study shows that individuals in the middle class are not into vulnerable employment such as agriculture. 26% works in the wholesale and retail trade such as vegetable vendors and sari-sari store owners. 17% of the pie were in communication and transport such as tricycle and jeepney drivers or bus conductors, and 16% worked in the government such as clerks and public school teachers. According to the National Economic and Development Authority, Filipinos have a long-term goal to live in a prosperous middle-class society where no one is poor by the year 2040. But how long will it take the poor and other low-income households to become middle class? In the computation in the study, it would take an average of 36 years for the poor to become middle income by the year 2051. That is why the study recommends for the government to re-examine its social protection policies and recognize that even the middle class may fall into poverty in the future. Harleen Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
National Bureau of Investigation Officer in charge, Eric Distor, warns the public to beware of COVID-19 scam. Beware of websites and apps that say they can track COVID-19 cases worldwide or related campaign. Criminals will use these apps to infect and lock your devices until payment is made. Think before you click on that link. And look out for fake or phishing emails. Examples of COVID-19 scams are treatment scams, supply scams, charity scams, app scams, bank or financial scams, investment scams, online selling, or other scam methods. If you encounter suspected emails or messages, let the NBI know through its Operations Center at 0961-734-9450 or refer to our NBI Anti-Fraud or Cybercrime Divisions with contact number 852-382-31238. You may also post or send a message to their website at www.nbi.gov.ph or NBI Facebook account, National Bureau of Investigation.
Meanwhile, the Health Department issued a statement today to remind the public it is not safe to use direct spraying or misting on surfaces and individuals. The health department says there is no evidence yet to support that spraying or misting activities, even on large-scale areas, indoor or outdoor, can kill viruses. The DOH also warns that spraying or misting has harmful effects on an individual and even on the environment. Spraying and misting can also cause pathogens to be dispersed further from the direct application of a spray. The DOH says it is better to soak objects completely or disinfect surfaces directly to kill the viruses and other pathogens. For the news abroad, here's Stephanie C. live from Hong Kong. Stephanie, good evening.
Good evening, William. The strip of land in Long Island Sound, dubbed Potter's Field in New York City, becomes a temporary burial site as New York copes with the coronavirus death toll. Aaron Romero reports why.
New York City has hired contract laborers to bury the dead in its Potter's Field on Hart Island. The city has reached grim new records of daily death rate from coronavirus. New York City is now the epicenter of the outbreak in the USA, with 5,150 deaths from COVID-19 as of today. Typically, about 25 bodies are interred each week by low-paid jail inmates working on the island. That figure started to rise in March as the new coronavirus spread quickly. Now, about 24 bodies are being buried day by day, 5 days a week, says Jason Kirsten, a spokesman for the Department of Correction, which oversees the burials. For burial on the island, the dead are wrapped in body bags and placed inside pine caskets. The deceased name is scrawled in large letters on each casket, which helps should anybody need to be disinterred later. And they are buried in long, narrow trenches excavated by digging machines. The city has used Hart Island to bury New Yorkers with no known next of kin or whose family are unable to arrange a funeral since the 19th century. Aaron Romero, UNTV News and Rescue. We serve the people, we give glory to God.
For Lebanon, the coronavirus outbreak came at a time when the country was already deep in financial crisis, but it has no choice but to impose a shutdown and even prolong it. In Chile, the business of informal workers are hurt. Jovic Burmas details why.
76-year-old Maria Rios is one of the vendors in the streets of Santiago, Chile, who insists on working despite violating government restrictions in a bid to fight COVID-19. The health ministry has ordered shops to close to control the pandemic. Rios said the quarantine is hurting her business.
I have to work because I have to live, to eat, so that I can eat, live.
This week, the Chilean government announced the creation of a $2 billion fund to support mainly informal workers who do not have access to unemployment insurance, although the mechanism for granting aid was unclear. Hungary prolongs its nationwide lockdown indefinitely to slow the spread of the coronavirus, Prime Minister Viktor Orban announced on Thursday. The Hungarian Prime Minister said the lockdown introduced last month had been successful in slowing the spread of the coronavirus and would be reviewed on a weekly basis. Hungary has officially recorded almost 1,000 confirmed cases and over 60 deaths in the pandemic, although the government has acknowledged the number of actual cases is probably much higher. The Lebanese government extends its almost month-long coronavirus shutdown by another 2 weeks until April 26, Information Minister Manal Abdel Samad announced on April 9. People are allowed to leave their homes only to buy food or medicine since the declaration of a state of medical emergency in March. Most businesses have closed. The only airport is also shut, except for a few flights returning expatriates stranded abroad. An overnight curfew bans residents from going outdoors between 7 p.m. and 5 a.m., with security forces enforcing the curbs. Slovakia closes off several Roma settlements in the eastern part of the country after reports of a cluster of coronavirus cases in 5 of them. The Slovak authorities say they would ensure food deliveries and access to healthcare in the enclaves, despite restrictions on movement. Slovakia has identified more than 1,000 locations with 260,000 inhabitants it considers at high risk because of a high density of population and poor living conditions. Officials say that hundreds of Roma returning from Western Europe in recent weeks may have arrived infected with the novel coronavirus. Slovakia has reported over 600 cases of the coronavirus and 2 deaths. Jovic Bermas, UNTV News and Rescue. We serve the people. We give glory to God.
To support testing, a 3D printing company has come up with its own way of participating in the fight against coronavirus. It says that its 3D printed swab actually has a higher accuracy. Noel Poliarco tells us why.
A 3D printing company in Boston has begun printing its own nasal swabs. About 12 Markforged people have been working day and night on the project.
The initial clinical testing shows that the new 3D printed swab actually has a higher accuracy in detecting both COVID positive and COVID negative patients.
Its engineers have gone through at least 20 different designs before coming up with a final prototype, a 3D printed nylon swab base with a wrapped rayon tip, which is now producing for testing kits for COVID-19. Researchers at Markforged partnered with Neurophotometrics, Rady Children's Hospital San Diego, the Scripps Research Institute, and the University of California, San Diego to design and test the swabs. The 3D printed nasal swabs have been tested on about 60 individuals at 2 separate times over several days, Mark said. They are currently printing 10,000 swabs a day and plan to scale up to 100,000.
This is a big deal because it will help give a more accurate test, which is the #1 way we can slow down this disease.
Some other facilities and companies with 3D printing capabilities have been producing up to millions of swabs to support testing. Noel Poliarco, UNTV, News and Rescue. We serve the people. We give glory to God.
India's network of trains, the country's lifeblood, has been idle, but some old train coaches have been given a new purpose as prototype isolation facilities. In the UK, a team of 650 medical workers will be deployed in the home of the Welsh International Rugby Union team to be called Dragon's Heart Hospital. Mirsol Abogadil explains why.
India transforms the sleeper carriages of decommissioned trains into isolation wards to treat a rising number of coronavirus cases. Indian Prime Minister Narendra Modi ordered the country's 1.3 billion people this week to stay indoors for 3 weeks in the world's biggest lockdown. On Thursday, workers were seen preparing the coaches.
In the coaches, we have removed the middle berths and the one laboratory of Indian style, which is blocked and converted to the shower room, where the bathing facility to be done for doctors, nurses, and also for patients.
A similar initiative was started in southern Chennai city, where people on two-wheelers entering the city were being sanitized. The National Stadium of Wales is set to become a field hospital as the UK fights to cope with the demand for hospital beds during the COVID-19 pandemic. On Thursday, medical equipment and beds were delivered to Cardiff's Principality Stadium, which targets to admit its first patient on Sunday, April 12. Given the Welsh name Isibiti Kalon Idraig, which means Dragon's Heart Hospital, 2,000 beds will be laid out. UK's COVID-19 positives are nearing 66,000. Mirasol Abogadil, UNTV News and Rescue. We serve the people. We give glory to God.
And those are the news from the other parts of the globe. Back to you, William.
Thank you, Stephanie C., reporting live from Hong Kong. Italy's usually packed squares are now turning green. Nina Armilio tells us why.
Some of Italy's historical piazzas are turning green, thanks to the country's strict lockdown. Almost 5 weeks into the lockdown, grass has begun growing in between the cobbled stones known as San Pietrini, in one of Rome's most popular squares, Piazza Navona. Tourists used to marvel at a stunning fountain designed by 17th century sculptor Gian Lorenzo Bernini. Now, the square is empty. Last weekend, Italian guitarist Jacopo Mastrangelo sent out a message of hope through his music on a rooftop overlooking Piazza Navona. And in the northern medieval city of Siena, a UNESCO site, grass and even some daisies have sprung up on the Piazza del Campo. The square hosts Palio di Siena twice a year, a horse race that dates back to medieval times. With no tourists or horses galloping over the historical site, it has turned into almost a garden. Italy's officials continue to urge the country not to go against strict lockdown measures, which they say are starting to show good results. Nina Armilio, UNTV, News and Rescue. We serve the people. We give glory to God.
When we celebrate our birthday, we often wish for something new, but for ourselves, new for ourselves. But Brother Eli Soriano, whom we say day and night preaching the words of God, wishes nothing for himself on his birthday. Brian Evangelista has the story.
Members Church of God International Overall Servant Brother Eli Soriano not just served food for the soul. The international televangelist has been known for his free public services, including feeding programs, not only for his compatriots, the Filipinos, but also citizens of other nations and races. In fact, when he learned that people in this part of Haiti were eating mud mixed with sweetener, it broke his heart.
Hindi lang pangangaral lang ginagawa natin. Nakakita ko nung isang araw sa internet, mga tao sa Haiti, kumakain ng mga bata, kumakain ng biskwit. Yung biskwit gawa sa putik. Yung putik nilagyan ng asukal. Tapos pinapatuyo sa araw. Yun ang kinakain ng mga bata. Parang nadudurog yung kalooban ko.
Though of different race, the Haitians feel the love that Brother Eli has for them through the feeding project. As Brother Eli celebrates his 56 years in service to God and humanity, he has a wish amidst the health emergency the world is facing.
73 years old na ako. Ngayon lang po ako hihiling ng regalo sa inyo. Kasi pag nagbe-birthday ako, gusto ko akong magregalo. Ang hiling ko regalo, mga kapatid, ay yung iniisip niyong gagawin niyong mabuti para sa akin. Gawin niyo sa kapitbahay.
And right away, those who heard Brother Eli's wish responded. Just like Bong and Lorena Ebol from Manila City. They gave away relief items to help ease the struggles of their neighbors with scarce food on the table amidst the COVID-19 crisis.
Pili kami pong mag-asawa, nais po namin magpaabot ng regalo sa pamamagitan ng pagtugon sa birthday wish niyo po. Kaya ito po, nagkanod kami sa ilang kapitbahay ng relief goods. Salamat sa Diyos sa mabuting pagkakataon. Happy birthday po, Bradley!
Jet Angon, a Filipino worker in Macau, sent money to the Philippines so he could help his neighbors by giving rice and other food items.
Brother Eli, bilang pagtugon po sa inyo pong kahilingan, sa inyo pong kaawat, ito po pong pa-birthday namin sa inyo. Salamat po sa Diyos sa pagtuturo na magkaroon po ng mabuting puso Dalangin ko po sana ay magkaroon pa po kayo ng malakas na katawan at patuloy pong gabayan ng ating Panginoon Diyos.
They and other listeners of Brother Eli's preaching are moved by the compassion that televangelist spreads. The more people act, the more will be reached and helped. Through this, we can heal as one. Brian Evangelista, UNTV News and Rescue, we serve the people, we give glory to God.
Our kasangbahay, we are at a time when the country is under a state of health emergency. The cooperation of all Filipinos is imperative to avoid the deadly virus. We are calling on everyone to be calm.
And most importantly, let us join together in prayer for our country and for the whole world to survive this crisis. You may join us in our daily UNTV community prayer at these hours as flashed on your screens. And those are the reasons behind the news. I am William Theo. We serve the people. We give glory to God.
And I am Angelo Castro III. Because we need to know. We will always ask why. Good evening.